We all can understand the detrimental impact that radiant heat from bushfires can have on our physical health. But what many of us don't think about is the impact that bushfires can have on other parts of our health. So today I'm here at the Menzies Institute for Medical Research at the University of Tasmania to talk with some of their experts about the other impacts that bushfires can have on our physical and mental health.
Hi, my name is Dr. Sharon Campbell. I am a postdoc researcher here at the Menzies Institute for Medical Research, part of the University of Tasmania, and my area of study is around extreme events like heatwaves and bushfires and the impact they have on the health systems.
Thanks, Sharon, and welcome. Can you explain how bushfire smoke can be problematic for our health?
Well, bushfire smoke is often thought of as a secondary item to bushfires themselves because bushfires have this huge media presence, things burn down, burst into flames, and bushfire smoke people kind of forget about. But what happens in reality is the bushfire only affects a really small number of people, but the bushfire smoke can affect many, many, many more people because of the way it spreads. So it covers a much larger population and it actually has a much bigger impact on people's health. So you could be breathing bushfire smoke that's come from bushfire hundreds of kilometres away that you have absolutely no control over. So that's why it's a real problem.
Given what you've just said, is it safe for people to be outside on really smoky days?
It depends, and I know that's a really uncomfortable answer for some people, but let's break that down a bit. So it really depends where you sit on the scale of risk and vulnerability. So there's certain people that are at higher risk and other people that are at lower risk. And it also depends on how long you've been exposed to smoke, so how many smoky days there's been, and the intensity or the level of smoke that you've been breathing in. So some of those groups that are at high risk are people that are older, people that are younger, so young kids, pregnant women, and also people that have medical conditions, existing medical conditions, so things like heart disease or stroke or lung disease or even diabetes. There's also some emerging evidence that bushfire smoke in the long term is really harmful for your brain, for your bones, and even your academic performance.
Is there anything then that people can do to keep smoke out of their house on really smoky days?
Yeah, so when it's smoky, it's really important to know how smoky and when there might be breaks in the smoke. And that can be a little bit difficult to ascertain unless you're using some sort of third-party checker. So we have a great app that's been developed by the university, by our group, and that's called Airater, so AIRRATER, and that helps you work out what the levels are in your current location. So use that air quality app. If it says it's green, then you're good to go. But anything kind of above green, you need to start working out if there's ways that you can reduce your exposure to smoke. So on those smoky days, you might want to stay inside and keep your doors and windows closed and fill up any gaps. If it's really bad, you might even want to consider wearing a P2 or N95 mask and fit that really well, because that will reduce the amount of smoke that you breathe in. You might also want to consider think about getting a air filter or a HEPA cleaner. And so they're pieces of equipment that can help filter out the particulates in your house. But you need to do some research on those first of all, make sure that you're buying one appropriate for the size of the room.
Is there any way that people can find out from their own homes what the air quality is like?
So if you download and you use your Airater app, you can get that on Android and on Apple phones. Then ideally, you're looking at that fairly regularly because on smoky days it changes back and forth quite a lot. And the more you use it, the more you're able to get a sense of what it looks like and smells like outside is related to the air quality that you're actually getting through the app. So on those green days, those good days, you're good to go. You can go outside, run around, do your thing. But anything, in the yellow, the orange or the red, as categorised by Airater, you might want to think about putting in action some of your things like staying inside or even going to like a cinema or a shopping centre or a library that has good air conditioning and getting a break from that smoke.
If people want to learn more, is there anywhere online that they can go?
Yeah, there's lots of resources which are fantastic. So since the 2019-20 fires right around Australia, then we developed lots of really interesting resources. There's a great set of resources at the Centre for Safe Air. and those links are with this video. There's also a fantastic course called Bushfires and Your Health, and we can put the links for that at the end of this video as well.